All right, I think we'll go ahead and get started. So I'll moderate this evening session, and we have a couple of things. I want to make this a very interactive session, so I want you guys to feel free to ask questions. We have a podium, a little microphone over there, not a podium, microphone. Get up, ask the questions. If you want to interrupt people as they're speaking because you don't understand how they're doing it, please do, because I think that's the most important part of this is a bunch of surgeons, maybe some others, getting together, figuring out good ways to do things and different things. So I want to keep it very kind of loose and fun, and it's the end of the day and we're all tired, so we're not going to stand on too much formality. We'll start with our kind of oncoplastic night and little tricks with Dr. Patricia Cronin. She did do these slides. And you heard her earlier, and she's actually had a long history doing oncoplastics and trained at a place where she had to do a lot of her own plastics. So she's really a great resource for us, and she's going to say what are the easy stuff for all of us to do.
So I've kept my slides quite simple, and essentially I have described how I approach doing breast conserving surgery, some of maybe the more, a little bit more advanced techniques that I utilize, but nothing too fancy. And of course, the truth of the matter is that for most patients undergoing breast conserving surgery, we don't need to employ anything too fancy as regards oncoplastics, but of course, there's much more to it, and there's certainly big difference between good breast conserving surgery and bad breast conserving surgery. I've no disclosures. So when we look at the primary breast tumor excision, obviously we have either can do breast conservation or mastectomy. My general preference is always to offer breast conserving surgery where possible. My mantra to patients is always bigger surgery isn't better surgery. And of course there are big advantages to doing breast conservation because they have a better cosmetic outcome. There's many studies that have shown that they're happier with their body, better self-image. And of course I think we sometimes underplay or underappreciate some of the post-mastectomy side effects such as sensory changes to the skin and chest wall that you don't get with breast conserving surgery. And of course, alluding to my talk earlier, of course, if you do breast conservation, you have a better chance of conserving their axilla and avoiding axillary dissection because you can apply Z11 criteria. What factors do I consider? One is obviously the oncological concerns. You need to be able to achieve tumor-free resection margins. That is obviously a mainstay.